Good morning. First of all, I would like to thank you. I'm very pleased to be here with you today. My name is Sam Salahia. I'm from Syria and PhD medical student at University in Egypt. Today we are going to talk about the efficacy and safety of Levosimendan versus Dobutamine in patients undergoing cardiac surgery. Okay. We all the authors, we have no conflict of interest to declare. First of all, more than 1 million patients undergo cardiac surgery every year. And the most serious complication for these surgeries is the low cardiac output syndrome. However, surgeons try to use inotropic agents that may prevent this complication, such as maybe Dobutamine, but unfortunately it has side effects, including arrhythmia and including also increasing for the oxygen myocardial consumption. However, Levosimendan is a new powerful drug which can be used in acute heart failure and also in cardiac surgeries, while most serious studies or previous studies showed the survival rate for Levosimendan was higher compared to Dobutamine. However, for the mechanism of action, Levosimendan is a calcium sensitizer which binds to the cardiac troponin C. Also, it works on the ATP potassium channel, which is opener for this, which gives the cardiac protective part. However, regarding to the advantages and disadvantages of using many different types of inotropic agents, which cause different complications, we tried in this systematic review and meta-analysis to differentiate or to assess the impact for each drug as the Levosimendan versus Dobutamine in patients undergoing cardiac surgery. However, our methods, we tried in this systematic review to prepare it according to the PRISMA and the Cochrane guideline. Okay, we search on databases, for example, as PubMed, Scopus, Web of Science, and Science Direct on Levosimendan, also Dobutamine and cardiac surgeries and other keywords related and alternative to Levosimendan and other cardiac surgeries. We screened the studies according to the full text and the title and abstract. Also, we have done the data extraction within maybe 4 reviewers. Also, we tried in the R programming software, we used it as for the analysis. However, here is the PRISMA flow chart. We have around 707 included study after removing the duplications. We tried to execute around 686. Also, we have finished with the 21 for the full text. We tried finally to get around 10 randomized control trials to be included in our study. Here is the Cochrane risk of bias as a quality assessment, which was a low risk of bias in the included studies as randomized control trials. Here is the summary and baseline sheet for comparing Levosimendan versus Dobutamine, which give us a type of the surgery, also timing for the drug administration and the duration for the drug administration also. We tried in the primary outcomes to get the many different types of hemodynamic parameters, such as mean arterial pressure, also the pulmonary capillary wedge pressure, which give us, as we can see here, which give us a low, which is significantly low in Levosimendan compared to Dobutamine. Also here, we can see for the pulmonary capillary wedge pressure. Okay, so we can see, but unfortunately we had a significant heterogeneity, okay, around 73% using the I-squared test and the p less than 0.01. So we tried to resolve this heterogeneity by excluding the first 2 studies of Gandam and Levin. Also for the pulmonary, we excluded the COGAN 2017. However, for the pulmonary vascular resistance index, also for the level of lactate, were also significantly lower in Levosimendan. It is also for the central venous pressure, also for the ICU mechanical ventilation duration, especially in hours, and also for the hospital stay, it was also lower or shorter duration compared to Dobutamine. On the other hand, we have the mixed venous oscillometry, which we can see here. It's a significant higher in mixed venous oximetry, also in the cardiac index, which can see favoring the levosimendan compared to dobutamine. Also, we try to exclude the heterogeneity by removing the last study of Cook in 2017, when the cardiac index, we tried to remove the first study. Also, for the stroke work index for the right and the left ventricle, it was significantly higher. However, on the other hand, as a safety part, we have noticed that levosimendan has significant lower risk of side effects for all except for the hypertension. As we can see here, it is related to maybe favoring dobutamine more than levosimendan, and there was no significant difference of getting pneumonia or dyspnea, having a dyspnea, or maybe need for dialysis or the stroke also. However, our conclusion find that levosimendan was very effective in patients undergoing cardiac surgery, also with less adverse events. So we support it as maybe a powerful inotropic agent. Okay, thank you so much. Any question?
Okay, thank you very much for the time. Just one thing, you said in the last thing, levosimendan gives more hypotension than dobutamine. This is what we found.
Yeah.
And then just before you say that it gives less vasoplegia than dobutamine.
Mm-hmm.
So what is the mechanism of the hypotension?
Regarding to the mechanism, as we said firstly regarding to the mechanism of action for levosimendan itself, it's an ATP potassium channel opener, so it forms a vasodilation, which give hypertension for the patient, especially if he was maybe acute heart failure or a patient undergoing a cardiac surgery. So it may less or give hypotension for him.
So it's so not logic to say that it gives less vasodilatation and then gives more hypertension.
No, it gives a hypotension regarding for the dilatation for these patients, which cause hypotension regarding to this as a result for it.
So you just choose studies where levosimendan was randomized against dobutamine, right?
Yeah, is that true?
So why did you choose only those and not, for example, other inotropics like epinephrine? Or what was the reason only to choose dobutamine as the competitive?
Yeah, actually I tried to search for this study for myself. I just tried to go online and just see many trials that's talking about levosimendan versus other interventions, maybe milirone or and something like that, as you say. For that, when I just checked the validity for this study, I've heard about previous network meta-analysis and meta-analysis that's talking about levosimendan also versus other interventions, especially for maybe milirone. And for the next time, I'd like to get another study that's related to the milirone.
So what is your standard therapy in your site in patients with low cardiac output syndrome following cardiac surgery?
From this study, as we say, as a result for statistical significance, there is an effective for levosimendan to be inserted in these patients.
So do you use levosimendan?
Actually, I'm a medical student, but yeah, 50 under that.
My next question would be, so you only have proven that it's efficacious and seem to work hemodynamically, but why didn't you look at, mortality, very hard endpoints?
Yeah, we tried to get the mortality, as we said, maybe we can just get the previous secondary outcomes. As we see here, there is a where is it? Mortality. Yeah, here it is. There is we have shown that levosimendan has significant lower risk of side effects and mortality, as we can see it here, with 2 studies from these 10 randomized control studies, and we try to just sort it as a subgroup analysis for this review.
Okay, so the mortality was significantly lower with levosimendan.
Yeah, that's what
to the-
we try
Thank you
to
very much.
do. Thank you so much.
Thank you very much.